Hi, Dr. Jesse Rossow with Kennedy Vision Health Center again, and in this video I'm going to be talking about glaucoma. Glaucoma is a scary disease. A lot of people have heard different horror stories about it, and a lot of people know stories about celebrities or relatives or something that have gone blind, and of course it is a scary thing to think about going blind. And I'm going to give you a little bit of information about glaucoma today and just explain a few things so hopefully you can understand it better and you can understand how we test for it and how we diagnose and treat it. So first of all, I have my eye model here again, and so I want to just show you the inside of the eye. So light comes into the front surface of the eye, passes through the cornea, through the pupil of the iris, and then through the lens, and then it focuses in the very back of the eye called the retina. So all the orange in there, this entire surface here, is called the retina, and that's basically like the film of the camera. The light hits that, and the image is transported through nerves back to the brain so the brain can see what's happening. And so the nerves all come together in a big bundle right here, the yellow half circle there you can see, and the blood vessels come through that nerve bundle as well, but basically the nerve bundle in the back goes back to the brain and transports the image. So that bundle of nerves is called the optic disc. And so when we check out your eyes and look inside and you come in for your exam, we're checking that optic disc for any signs of glaucoma. And there are a few different signs that can indicate glaucoma. One of them would be bleeding of the nerve, of course, or any swelling. But generally we're looking at what's called the cup portion of the inside of the nerve. So the nerve actually has a depression or a cup in the center, and that size of that can indicate possible damage or issues. So I'm just going to show you a typical nerve. It looks like a circle, and the inside circle is the cup, and it's the depression of the nerve. So all the nerve fibers are generally in this outside portion here. And basically what glaucoma does is it slowly kind of kills off the nerve fibers, and it makes this inside circle larger and larger and larger until all the nerve fibers are dead and gone. So instead of being a nice small circle like that, generally it's going to be a lot larger like this circle I've drawn here. So instead of being small, it's gotten larger, and it's killing off the fibers. And that is something that obviously we don't want, and nobody wants to go blind. But of course, we're going to be checking for any of those signs when you come in for your exam. Now, if we've determined that you happen to have some signs of possible glaucoma, of course we'll let you know, and we'll recommend that you come back for glaucoma testing. Not every office has all the machines for glaucoma testing. However, at Kennedy Vision here, we do have all the machines necessary to test for glaucoma, and we treat glaucoma as well, and we can determine whether or not that you do have the disease. So basically there's a few tests that we do to help determine if you have glaucoma. The first test is what's called a visual field test. So that's going to be a test that's going to take your input and check your side vision very carefully and your central vision, but glaucoma typically takes away your side vision first and closes in and eventually gives you tunnel vision and then complete blindness. So the machine's going to check your whole visual field to see if there's any damage there, and so that's very important for us. The next test that we have is called an OCT scan, and basically that machine is going to take light and it's going to scan your nerves in the back of your eyes and count up all the nerve fibers, calculate the size of the cup in the center, do a whole lot of things for us, just an evaluation of the nerve, and it's going to compare all that data to a normal database of hundreds of other people your same age and tell us if there's damage or not, and just give us some very important information on that. It also checks the angle in the front part of the eye where the fluid drains out to make sure there aren't any blockages or any narrowing of that passage for the fluid to pump through. And it also checks the corneal thickness as well. And that's going to help us to determine if the pressures in your eyes where they're at, because our machines are all calibrated for an average corneal thickness of 540 microns. If your cornea is thinner or thicker than that, we need to adjust our readings to make them accurate for you. So a machine does quite a few things for us, and this is a side note, but it can actually check the retinas as well for any retinal diseases and show us all the layers of the retina for macular degeneration or any sort of retinal disease in the central area there as well. So, but as far as glaucoma goes, it does that for us. Now also we'll check your pressures and a few other things too with the exam, and just compiling all that information together, we go over all the data with you the same day we do the testing and describe our concerns and let you know how things are going and determine whether or not you have glaucoma. Sometimes we need to have you back for several rounds of testing to determine if things are changing or getting worse, and sometimes it's evident right away that glaucoma is there. But if we do determine that you have glaucoma, the treatments are generally not a huge change to your life. Typically, we would start you off with a drop at night to lower your eye pressures. There are several different types of drops and things, but generally the one that we start off with is one that you would just use at night before bed, one drop in each eye. And that drop is going to lower down your eye pressures, which in turn has been shown to slow down the damage of glaucoma. There is no cure for glaucoma, and there is no way to reverse the damage, so it's important to catch it early. And you will never notice any signs of glaucoma typically until it's very advanced and it's too late to help you. So very, very important to get yearly eye checkups to make sure that everything is looking okay. And if we see any concerns, we may recommend exams way more frequently than a year, maybe 6 months or even sooner if you're determined to be a high-risk suspect. So basically, we have all the machines here to do the testing, and if we determine that you're someone who we consider a possibility of having glaucoma, then we would have you back for the testing. There are several risk factors to glaucoma, family history being one of them. African American, certain races have a higher incidence of glaucoma. There are quite a few things, one of them being, the thickness of the cornea. People with thin corneas have a much higher risk of having glaucoma as well. So, there's several factors that play into it, and certainly something that, again, we would inform you of once we did the testing. So, if you have any more questions about glaucoma or, you're specifically concerned about yourself, certainly give us a call and come in, and we'd be happy to inform you about your specific risk and any concerns we might have about your eyes. Certainly we'll also check for any other diseases as well, but basically we can give you any information you'd like to know about glaucoma, and we'd be happy to do that. Again, Dr. Jesse Rossow with Kennedy Vision Health Center, and I hope you have a great day.